I'm here virtually today with Dr. Lauren Grodin, who is a licensed pediatric psychologist at Joe DiMaggio Children's Hospital in Hollywood, Florida, where she serves as the pediatric psychologist embedded within the pediatric cardiac, heart transplant, and kidney transplant programs, as well as the pediatric dialysis program. Dr. Grodin has been practicing for nearly a decade, providing mental health services for children and families in Maryland, Texas, and Florida.
So what advice could you give to parents specifically around talking points for their kids? Because I do think a lot of times people want to have those conversations. They want to make sure that their kids are prepared for what's coming at them. They want to teach them good coping skills, but a lot of times I don't feel like we know how, or we feel like we have the right words. So what are some of those things?
So I think it really partly depends on the age of the child. Now, for younger children, we're going to use more simplistic terms. We don't need to necessarily overshare, really share based on what the child knows about what's going on in basic terms, and with a focus on the things that we're doing to keep them safe and why we're doing these things. And also talking about how we feel, because again, when we model healthy coping and model sharing that it's okay to struggle, and these are the things that we're doing to work through that right now. And also remembering that this is not forever. This is just for now. And we're going to work through this together. And what questions you have, please come to me. I think having that open dialogue that's available to kids, so kids knowing that they can come to their parents or their trusted adults when they are having a hard time, just opens up that gateway for sharing and being able to feel comforted. I think that's really important. So just being able to open up those conversations, talking about what you feel is best for your kid. Every child is different. And so there's no one answer to that, but feeding off of your child's cues and just letting them know that you're there to support them through this all, and we're going to get through it together, and it's not forever, and we will get to the other side of this.
So you mentioned it earlier, and kind of, I just have maybe one or two more questions, but you talked about we're all figuring out how we work from home, how we keep our kids working on their schoolwork, how we balance that with taking a walk outside, getting some fresh air, staying healthy. What are some tips you can give us for how parents work from home and how we continue to support our kids?
That's a really good question. And we know many families are struggling with the adjustment of working from home while taking care of their kids and keeping their kids educated on virtual learning. In essence, these are 3 full-time jobs that we're juggling all at once right now. It's a lot. So I think the important piece of it is finding a balance that works for you and your family. There's no one right way. You may see one family that is sticking to a really concrete, consistent schedule every day, and it works for them. Whereas for other families, that may not work. And it's okay, and it's important to not put too much pressure on yourself to stick to that one hard routine every day if it's causing more stress than being helpful for you and your family. So I think families need to focus on being forgiving with themselves, forgiving with their kids, knowing that their kids are going through a lot just as they are, and doing what works for them. So just find time in the day. You know, we need to get some of our virtual learning done, create a schedule that works, and it may change on a day-to-day basis. Finding time to get outside and get some fresh air if the weather permits. Being flexible is the key. And I think what's most important is that mindset that, you know, not everything is within our control right now. We're going to focus on the things that we do have in our control, and we're going to give ourselves credit for the things that we're doing okay each day, and also praise our kids for how great they're doing as well, because they need that praise and that feedback. They need to hear it, even though we may think that they know we're proud of them. If they're being good and they're being quiet, and we're busy getting our things done in the day, you know, sometimes it's good to just check in and say, hey, I love the way you're sitting there doing your work. I love the way you cleaned up your room so nicely without me asking you. Those statements go a long way to help kids cope. So just being forgiving with ourselves and flexible is the key.